Hello, everyone. Hi there. How you doing? It's me. Look down, square. Little. Oh, sorry. Uh, so yes, I'm in the little tiny square down there at the bottom. My name is Bill Ballo, and I am I am non-instructional faculty at our Center for Excellence in Teaching and Learning here at Madison College in Madison, Wisconsin. I am actually a paramedic by trade and have come from paramedicine. I've been a paramedic for the past 24 years and a paramedic instructor now for the past 12, 13 years. Um, I have been here at Madison College for the past 7 years, and I have been teaching in the EMS department. And just recently, in the past year, I was brought over to our Center for Excellence in Teaching and Learning to help our college transition in, our COVID environment, transition over to utilizing tools like Microsoft Teams and WebEx and Blackboard Collaborate Ultra, all those kind of things, as well as to advance our virtual reality initiative. I am not joined today by John Bruchot, the founder and CEO of Arch Virtual, who are the developers of Acadicus, the program that we are using. But John, sends his thanks and his hello. Was not able to join me in this recording. And that's okay. If there's any questions for John, we do have some information at the end how to get in touch with myself and John as well. And you can see down there, acadicus.com. So just to get some things out of the way as far as conflicts of interest, I work for Madison College, but I am also an independent contractor for Arch Virtual. So this is not a sales pitch in any way, shape, or form for Acadicus. It's just to show you what we are doing in virtual reality and the program that we at Madison College have chosen to go with. We use Arch Virtual as an independent contractor to us. So we contract with Arch Virtual to help us develop our virtual reality initiative. So let's talk a little bit about some of the things that we have and can do in virtual reality. So I am going to focus a little bit on the medical stuff today because, well, I'm a medical person, okay? But we're going to talk about using virtual reality in a headset. So you can see this person over here wearing the headset. And we'll also talk about virtual reality in what we call viewer mode, okay? And this is without that headset and still being involved in virtual reality with viewer mode, okay? So we're going to talk about that as well today, too. And I'm going to show you some really cool stuff as well. Here's a little information, a little background on Arch Virtual, the company that we have chosen, Madison College has chosen to partner with. So a little bit of background information on Arch Virtual. And they have been helping us quite a bit get our virtual reality initiative off the ground. I started out as not really actually putting on a headset. I really hadn't done it. Well, I guess in the 90s, or 80s maybe, when you could go to the mall and you could put the headset on, you could shoot the aliens and stuff like that. Yeah, I did that, but that was years and years ago. That was the last time I was in a virtual reality headset. And now I'm using virtual reality headsets on a pretty regular basis. And it's really only been a little bit more than a year. It's really only been a little bit more than a year. Probably, I'd say maybe about 14 months, maybe 15 months that I've been, putting on that headset and actually getting in there and doing some work. So we'll show you some of the great stuff that we've created, and there's even a little demo video that's coming up. So what do I like about doing virtual reality and utilizing the platform Acadicus that we use? What I like about it is it builds upon the things that we've already been doing in our sim labs, right? So in the sim lab, I go in and I get my mannequin ready, I turn the mannequin on, I go back and I get my computer all ready and get everything ready to go. Maybe that day the mannequin's going to be wearing a different outfit or something like that. So I have to dress the mannequin, get the mannequin prepared and all that kind of stuff. And then my student comes in and they do the simulation, and I, as the instructor, am able to watch live in person what they're doing and then give them a good debriefing afterwards, or even watch them as they're doing it, right? Using formative and sort of watch them as they're doing it and help them out, help them through it, give them some tips, give them some ideas, give them some tricks as to make things in order to make things easier for them or to just do a better job. So that's what I like about what we're doing. We are focusing mainly on the synchronous rather than the asynchronous. Okay, so there is the asynchronous out there where you can, just push the button and go, I gave nitroglycerin, I gave this medication, right? And it's yes, you did it right, or no, you didn't do it right. And the instructor gets a whole lineup of they did this right, they did this right, they didn't do that right, they didn't do that right, right? But it doesn't give me that ability to like be in there with my student, actually seeing them interact with a real patient in real time. Okay, because I can have multiple people in there. I can have my student in there. I can have other students in there. I can have other instructors in there. So maybe I want someone to be my sim tech, my sim operator, and I want to be the person that's talking for the mannequin or talking for the avatar, right? So I can do that. Okay. The other thing about my mannequin, I don't know if you've noticed it about your mannequin, but yeah, I mean, you can change things like you can change their hair. You can put on wigs or something like that. You can use different dress or something, or you can some of the skins on them can change and stuff like that. But basically, my mannequin's still my mannequin. It just kind of sits there, and it's really neat. They're amazing. They've got all these great features on them. But it's missing a little bit of realism too. Okay. Now, what the mannequin has that I'm not getting in my virtual reality is that tactile feel, right? So that tactile feel of actually, let's say I'm going to intubate a patient, right? And I put the laryngoscope in and I pull I pull the tongue out of the way so I can see the epiglottis, right? And I'm getting ready to intubate my patient. There's a tactile feel to that. Now, I can't specifically get that in virtual reality. So if I have my laryngoscope here and I go to intubate the patient and I let go of my laryngoscope, well, in real life, the laryngoscope hits the ground, right? But in virtual reality, it will stay there. So gravity is not there, right? So we're not replacing the tactile feel of actually doing the skill. But what we're doing is prepping the student all the way up to the actual skill, right? It also cuts down on the amount of lab time. So my students will come into the lab and they've seen an epiglottis now. They've seen what it looks like in the virtual reality avatar. So I layer it kind of like a cake. What I do is I start off by, recording a video for my students within a catechus, within the program. I record a 3D video. So now I can go in there and I can intubate, with a camera, I can show, okay, if you go in here and see the epiglottis, okay, there you go, right? That's what I'm looking for. My student can then watch that in 2-dimensional. I can upload it to YouTube and my student can watch it. The other thing my student can do is they can come in viewer mode and they can watch it as a 3D recording. So that means they don't just watch it from one perspective. They can move all around. They can go anywhere they want. They can get behind me and look over my shoulder. They can do whatever they want in order to see what I'm doing, right? So if I'm showing them a heart or something like that, they don't only have to be looking from one perspective. They can be moving anywhere around and watching that lecture. Okay, so I can record that lecture. I can leave it in there. My student can go in, hit play, and they can watch that entire lecture. And it can be a 3-dimensional lecture rather than me just standing in front of the class. Okay, so that's beautiful. That's amazing. The next layer to that is now to get us in there together, right? So I bring all my students in if I can, and I'm holding up a heart, and they're asking questions live, right? Or I'm using Zoom, or I'm using WebEx, or I'm using Microsoft Teams, or something like that, to show at home exactly what I'm trying to show, right? I have a camera set up, and I just go to the student up to the camera that's in virtual reality. It's a VR camera inside virtual reality, and I just go up to it and I go, see, look, there you go. Look at that pulmonary valve. See that pulmonary valve right there? Okay, where does that pulmonary valve go? Anybody? Right? And then they can answer. All right. So that's that real-time instruction. Then the next layer to that is to have them come in and practice, right? To have them come in and practice. Maybe I want them to learn the skill of intubation. So they're going to go in and they're going to intubate the avatar in a catechus, right? And then later on, they're going to come in and they're going to intubate a real mannequin in the sim lab, or potentially after intubating that mannequin in the sim lab, they're going to go on to intubate an actual human. So I can have them practice it over and over and over and over again, as many times as they want or as many times as they need. And the beauty of this is that I can customize it too. I can say, I want this, I want this. Oh, you know what? I don't like that BVM. That doesn't look anything like our BVM. Is it possible to get this BVM put in? Or, Me, I wanted a really, really detailed heart because cardiology is my thing. So I wanted a really detailed heart, and I wanted to really be able to pick out all of the different structures of the heart. And so I can customize that to say these are the things that I want. Okay? These are the things that I specifically would like. Now, you'd probably say, well, it's probably just for medical stuff, so maybe I should just stop watching this video. Well, no. As a matter of fact, here's our veterinary suite. I shouldn't say our, or here's Acaticus's veterinary suite. And the students can actually go in, they can turn parts on and off of the vet mannequin there. So they can isolate out just the digestive system, or they can isolate out a specific muscle group or something like that. Down here, we are working on something with our HVAC. Our HVAC faculty. We have HVAC faculty who are developing a program that allows, developing a scenario that allows the student to go in and do all of the same stuff they would when they're hooking up to the HVAC system. I'm not an HVAC person, but they're hooking it up to the HVAC system, right? And they're doing all of that, and there's Freon and all of this stuff that can potentially leak out of it, right? And so instead of starting off by doing that in the lab where the student can make that mistake and Freon's everywhere and now it's an atmosphere issue or fines or whatever it may be, they can do that in the VR environment. And I've gone in and played with that, and I know nothing about HVAC, and I can tell you I have leaked stuff all over the place in VR multiple times, but there's no danger. There's no danger to me. There's no danger to the environment. So what? I leaked it in virtual reality. Start back over again, okay? And I can try again, all right? Now, again, I have focused mainly on the medical, and that's what I kind of continue to focus on. But the students can join either through virtual reality, and you do need kind of a good computer, so you need a gaming computer, and you need a headset that's wired. So you need a wired headset in order for that to work really well, because these graphics in here are very, very high quality graphics. All right. But your students can also join from the non-VR. They can join from the just logging into Acaticus and clicking on non-VR, and then they can move around using their mouse and using their arrow keys. Okay. The other thing that we have done is we have used Zoom or I use WebEx. Madison College does not support Zoom, but I've used WebEx, and I've had my students join, and then I've given a lecture in virtual reality, sharing it via WebEx. Right? So I can show everything that I want to show. My students can watch all of that and be completely involved in it. Now, we have had people ask, well, can they join from, say, phone or tablet or something like that? Not yet, and the only reason being is that once they get into this, there's really no way to move around. So they really can't move around in there. One of the things that we came up with, because, it was the partnership, John and I, we came up with the idea of putting Acaticus onto our VDI. So if you have a VDI at your college, we put it onto our VDI, and then our students could access it from like as little as a Chromebook. Okay, they just needed the arrow keys and the mouse to be able to move around, and they were able to access from even a Chromebook. So they could get in, they could see all of the 3D recordings. Granted, they had that extra step of having to access the VDI first, but once they were into the VDI, it was really easy to get into Acaticus, open up the program, and just run through. So obviously, coronavirus, COVID-19 has changed the way that people look at what we're doing quite a bit. But we're still forging ahead in the idea that we're going to have our students eventually back and in headsets, because we want our student to really be immersed in that environment. And so we went with different ways of cleaning them. There are some different ideas as how to clean them properly, using ultraviolet light. We use wipes and all of those kind of things to make sure that there's safety for the student. Obviously, we want that non-VR mode to be accessible to the student, because it does help, right? Some students will put on that headset and feel very, very disoriented. But they go in a non-VR mode. They go in that viewer mode, and it's actually a little bit easier for them. They can move around. They can sort of determine how they interact with it. WebEx, we've used it quite frequently with WebEx, where we've done some screen shares. I have a meeting later on today to help one of our other faculty members get started with virtual reality, and I'm going to show everything via WebEx. And then, of course, what we really want is that on-campus, actually in the headset. We want the student to put that headset on. We want them to be fully immersed in the environment and actually feeling like they're really there. We're developing a mass casualty incident right now with explosions and all kinds of stuff, and screaming and sirens, and we want that student to really feel like they're actually in that environment. And then, of course, on campus as well, you can project it. So you can have it up on your board so that your student can see either what you're seeing or bringing in another virtual reality camera so that they can see it from a sort of a more fixed point of view. So again, our main focus has been on the synchronous. We have developed some of our scenarios for asynchronous learning so that our students can come in and they can make decisions within there. What we wanted to keep was the critical thinking. We didn't want the student to just come in and go push button. Nope. Push this button. Yep. That's not going to happen out in the field. They're not going to be able to just push a button. There's my patient laying there. Let's see, he's complaining of abdominal pain. Where's the button to push to get him to, give Medicaid? Where's the button? No. So we didn't want that. We wanted that actual real feel. Okay. Whether it be in viewer mode or whether it be with that headset on, we wanted that student to really feel like they were interacting with the patient. Right. And we get that in both the way we have developed our synchronous, obviously, and our asynchronous, because now our student can come in and make a decision. Our asynchronous respiratory therapy scenario, the student comes in, they look at the patient, they talk to the patient, right? They get information from the patient. They actually get a care plan for the patient. And then they go in and they go, okay, well, this is what's going on. This is what his O2 sat is. There's where his blood pressure is. There's where his end-tidal CO2 is. I think this patient's going to need a non-rebreather mask, and so they can go over and select the non-rebreather mask, and then they can choose what liters per minute they want to run it at. So I'm going to run it at 4 liters per minute non-rebreather mask. Now, those of you that know anything about medical, you go, that's not right, right? And it will tell them, yep, no, wrong, So they go, oh, well, all right, let's bump that up to 10 liters per minute. 10 liters per minute will work, right? Or 15 liters per minute, right? So it actually still has them doing some critical thinking, even in the asynchronous mode, and not just in the synchronous mode itself, okay? The other thing that's built into Acadicus is a simulation manager, much like we have on our mannequins in the sim lab, where you can change all of the values, right? So if I wanted my patient's heart rate to be 126, just pull the slider over, 126, and there you go. And that'll show right up on the monitor, and the patient will show at 126. And so you can change all of those vital signs just like you do in with your sim managers. You can have their shirt off. You can have a mask on them because maybe they're a potential COVID patient. There are even some animations in there where the patient's like, no, I don't want to take my meds. No. Right? Crosses his arms, gets really angry, turns his head to the side, right? Like, no. Okay. So there are animations in there as well, and more to come every day that allow you to really give that feel of even someone that needs to be talked to and we need to discuss with them. Hey, this is why you need to take your med. No, I don't want to take my medication. Leave me alone, right? And you as the instructor can decide whether or not your student has gotten to the right part of de-escalating that situation. And now you can, okay, now, all right, fine, I'll take the medication. Just give it to me, right? So that's the customization. That's the customization aspect. You can do 3D demonstrations. I mean, you could hop in tomorrow and do a 3D demonstration. It's easy. It's really, really easy. Once you get in there and you get used to the program, I mean, I put my headset on, I'll do a 3D demonstration. Okay, I'm going to do a 20-minute 3D demonstration. So put my helmet on, go in there, hit record, and start doing it. right? I know enough about cardiology. I'll pick up a heart and go, okay, here's what this is, here's what that is, here's what that is, right? And my students love it. They'll love it, because they can just come right in and they can watch a 3D recording. All right, so this is sort of from the SimTech's point of view, and here's your simulation manager. It's pretty simple, pretty easy to use, and it even has some presets on it as well. And so you can, sort of say, well, I want this person to be angry, or I want him to have his eyes open or closed or half open. I want his head to be a little cocked off to the left, or whatever it may be. So you can change a lot of the things that are in here, and this is sort of growing as time's going on, and people are going, oh, I want to be able to change this, and I want to be able to change that. Okay. From the learner role, they don't see that. They don't see your simulation manager. You're in there with your simulation manager, but they're not seeing your simulation manager. They're not seeing all the changes that you're making on the back end. They're just coming in and seeing the patient just as you would if you were seeing a patient in the emergency room. Okay. And then all of the different areas where you can have your patients. So right now, we have a bunch of downtown stuff and a bunch of resident stuff that we've been working on the most because we're an EMS. But we have Dr. Nick Slayman has actually been working on a lot of the pediatric stuff. So and then obviously the emergency room. We have an emergency room set up because I want my students to be able to come in and see what it's like and feel what it's like in an emergency room. You can have an emergency in an office. There it is. There's even an OR. There's a full OR. And the nice thing about this program is that all of the stuff that even other places are building, we can utilize. So one of the things with this program is when you go in and you create custom content, you can get a really, really, really big discount. Like I think it's like 80% discount on custom content by allowing other places to use it. Almost everybody goes with that because it benefits them financially, and it benefits them in the program itself, because anything anybody else creates, you can utilize as well. It's great. It's really great. So a lot of scene editing can go on here, so you can pull all kinds of stuff in. This is a little bit more of the advanced learning, but once you learn how to use this and learn how to go through where the packs are and where things are at, you can just pull things out and say, all right, I want a bed over here, and I want, let's put a blood pressure machine over here, and let's put a monitor over here. And you can kind of set the scene up any which way you want. Okay, it's a little bit more advanced, but once you learn how to use it, real easy to set the scene up any which way you want. Give you an example. I wanted to do a little demonstration on what it would look like if there was an outside emergency, right? So I wanted this kid who had fallen off a scaffolding. So I needed a scaffolding, a kid, and bystanders. And within about, 10 minutes, I had a scaffolding, I had a child, and I had bystanders. And I just put them all where I wanted them to be. And then I kind of, did a video of my my setup from there, and was like, oh wow, look what's going on over here, right? And then would give my students a chance to say, all right, well, here's what I would do first, here's what I would do second, here's what I would do third, so on and so forth. Okay. Just an overview. This is my cardiology room, definitely one of my favorites. That heart is huge. If your heart's that big, you're very, very sick. Okay, or you're a giant, one of the two. This is our dynamic cardiology room, which you'll see in the video coming up. You'll see the intro to the dynamic cardiology room and sort of everything about that. Here's our NICU, and then there you can see the operating room. There's the outdoor suite. So a lot of places to operate, And then our characters are diverse. They're very diverse. You can choose whatever you want and say, this is the person I want now, this is the person I want now, this is the person I want now. Now, the animated avatars, some of them will be specific. You have to pick specific avatars for animated avatars. But as time goes on, all of these avatars can be animated. Okay, there's the environment settings. We just talked about some of those. And then this is Dr. Slayman, this is Dr. Nick Slayman, who's actually doing a recording on setting up for, I believe this was for pediatric intubation, and he went through and talked about where everything would be placed. Now, the student can go in right? And they can watch from right in front of Dr. Slayman. So they can say, I just want to watch what he's doing. I want to be able to look straight down at what he's doing. But this person could actually move around to the other side and stand right next to Dr. Slayman as he's giving his lecture, and he can that he or she, this is a she in here, he or she can watch whatever that doctor is doing, and then say, wait, hold on, stop. I want to see that all again. Let's go back, start it all back up again, and you can start it all back up again. Okay. So you as the instructor can go in and record in your expertise, your area of expertise, and your student can then come in and watch that. Okay. I even have some recordings on there that are open source to anyone. You can go in there. You want to go, check out my cardiology, my anatomy of the heart video. It's in the anatomy room. You can go right in there and you can check it out. It's really neat. It's really neat. Okay. We have put in some follow-up questions. Now we don't have this is not an LMS. So we don't have like a scoring system or anything in the background that's telling us exactly what numbers the patients got or the students got right. But this is allowing the students to do some of those follow-up questions and say, well, this was the medication I gave, or which medication would be most appropriate in this situation. The other thing is the debriefing, and I can't speak enough about that, because the difference with the debriefing when I take my students out of the simulation room and then we go and debrief, or sometimes we debrief in the simulation room, I can actually replay. I can go back and say, wait a minute, hold on. He was set up exactly like this. This is what happened, and this is what you did, right? So I can go back and show all of that. And then we can also record all of our debriefings as well, okay? Just an idea of how many things right now are already in, and some are in development. Dynamic cardiology at this point is done. Respiratory therapy at this point is done. The nursing cases, and this was Grant. This was done by Grant. EKG placement, all of that. All of this is already done. It's already in there as far as phase 1 simulations. This is a minuscule amount of things that are already built in the program. Okay, so this program's been out for years. This is not a brand new program. So there are tons and tons and tons of assets in there for you to use. You can obviously email info@acadicus.com if you have any questions about Acadicus. You can also email me, wballo, B-A-L-L-O, at madisoncollege.edu, wballo@madisoncollege.edu. What I'm going to show you right now is what it looks like to be. It's going to be on YouTube, so it'll be two-dimensional. But I'm going to show you exactly what it looks like in a lot of these assets that I just talked about. So at the end of this video, I'll probably come back on for a second or two and just, say my goodbyes. But I want you to take a look at this video. It's about 20 minutes long, and it is posted on my YouTube channel. Again, search Ballo Medic, B-A-L-L-O-M-E-D-I-C, Ballo Medic on YouTube, and you will find my YouTube channel. So I'm going to go ahead and show you that right now. So we're going to get this out of the way, and we're going to bring this back up. And here is our demo. I hope you enjoy it.
Well, this is it. Welcome to Acadicus. So we're actually starting off in the dynamic cardiology room. And you'll notice, looks like somebody's house. Well, that's the whole idea. So when my students come in, I want my students to feel like...
Just a really quick thing that I want to say is there's a little popping in my audio, and that was because of a loose wire that I had on my Rift S. That has been taken care of. That was on my end. I apologize for the little bit of poppiness that you're going to hear in here. My apologies for that.
They're actually in someone's house. I want them to feel like they're here and like they need to take care of this patient right here. So this is Miles. Now I have a sim tech that's helping me out today in this recording. And so I'll ask for a few things and you'll notice that it will happen. And that's because my sim technician is also working with me. So, if I come into Miles's house, usually I'm coming in from, somewhere over there, and I'm not going to be standing right at Miles's head just when I appear. But when I come in, I may talk to Miles and ask him how he feels. Ask him what's going on today. Ask him why 911 was called. Okay? And you, as the instructor, you get to tell them. You have the script that you're working off of. You can design that script in any way you want. You can make this patient into anyone you want. Now, some of the things that I would do while I was asking Miles about what was going on today and how he was feeling and why we got called out here, maybe I'll get a set of vital signs on him. So, for example, I'll pick up a blood pressure cuff, and then I'll just move over and put that blood pressure cuff right down there. Right? And as we do that, so I position the blood pressure cuff just a little funny there. Okay? As we do that, you noticed that I was trying to take a blood pressure over his shirt. Well, my simulation technician realized that that's not a good idea, that I can't take a blood pressure over his shirt. So I can ask my simulation technician to remove his shirt, right? If your student forgets, it's going to be a little odd trying to get that blood pressure cuff to get on there. That's the realism that's available in this format. So because I had his shirt on, it was a little hard for me to get that thing to go on there. And my simulation technician, thank you, SimTech, took the shirt off for me, and then I was able to get that blood pressure cuff to go on really easily. Okay? So again, realism. And it's very important. Now, Miles says he wasn't feeling very good. He was feeling kind of dizzy. For those of you that are in the medical field, you're already looking at his EKG and going, yeah, that doesn't look good. And he probably wouldn't look this good, right? He probably wouldn't have a real nice skin temperature and condition like he does. Well, that looks more realistic. Yeah, that looks pretty realistic. And just the feeling that I get from seeing him go to this condition, looking this bad. Now his eyes are closed. He's not responsive. He may be slipping into cardiac arrest on us. You know what? I noticed he's not breathing very well, so I should probably get the BVM. I think I really need to ventilate Miles a little bit. Right? So I can ventilate if I want to ventilate. I can pull my oxygen bottle out. I can set my oxygen bottle down. Right? I can have this right here with me. I can make decisions. I can tell my instructor I want to turn it up to 25 liters per minute.
And for those of you that are in the medical field, you realized that Miles doesn't have a pulse anymore. And here I am still talking, and as an instructor, I know, this is taking way too long for him to look at the EKG. He better start looking.
And that simulation is there. That realism is there. Maybe Miles didn't need the BVM. Maybe Miles only needed a non-rebreather mask. Maybe he wasn't quite that bad off. So I could put a non-rebreather mask on him. Or, you know what? Maybe he is that bad off. Maybe he's going to need some pacing. Or, maybe he's going to need, eventually, defibrillation. Of course, we hope not, but that's always possible. Okay? And so we can have our pads on. We can put our normal EKG on. Here's my EKG lead. Right? Now, I'm not going to go around and put every single EKG lead on to Miles here. Okay? But in the SimTech, on your simulation manager, you'll have a button or a little holocron that lives in your room, and you'll be able to hit that button. When your student says, I'd like the EKG to be put on, you hit the button, a recording comes in and puts that EKG on for you. Okay? Just as if I were working with my partners. Because remember, I'm not going to be working by myself on Miles here. I'm coming in with my partner. I'm coming in with maybe the fire department, depending on how bad off Miles actually is. So I want those other people to do things. I want my student to say, I need this, I need this, I need this. Maybe my student says, you know what? Miles really isn't looking very good now. Let's get some CPR going. Now, that recording will come in and we'll start CPR. It'll go for 2 minutes, right? And the student can then say, stop CPR. And you on the other end, you hit the button, you stop CPR.
Now, one of the reasons we didn't have the recording in here doing CPR is because I wanted you to also understand that you could have someone else in the room doing CPR. So you could have another student that's also in there that's now responsible for doing CPR, or responsible for BVM, or responsible for oxygen, or responsible for IV, whatever it may be.
CPR. So again, it's that realism. It's that realism, and it's that immersion in the environment that we can get from using virtual reality like this. Well, and speaking of immersion, here we are in, I don't know, looks like my home state of Florida, to be honest with you. It's pretty beautiful out. We're here outside. We were just in someone's house. So you can see, you can really bring your students anywhere you want to bring them to. The program that this was originally done for is actually a fall safety program. And it was all about how to secure your harness and how to secure your scaffolding. And based on the decisions that the students made, the outcome might not always be good. Now, of course, what's nice about this is this was used for a different program. This was used for, like I said, fall safety. But that's something that we in EMS, well, what happens when you fall? We got to come out and help. And so we come out, and here we are. Now, you can see that all around here, not only do we have some bystanders, which would be very normal in a case like this, but we also have fire engine, right? We've got our ambulance. We've got our downtown scene. You can have cars parked around here. I mean, this tree, it looks like I can almost pull one of those leaves right off of that tree. So really, as far as customization goes, there's not much that's better. You know, you may be able to use certain scenes, but those scenes are set. They're set. I mean, are you going to be able to come in and do customization and say, I want this EKG, I want this emergency bag, I want this type of scaffolding. In those asynchronous programs, not going to be able to do that. In a synchronous program like this, you can do that. This ambulance right here, John and I actually did a lot of pictures. We took a lot of pictures of what was inside one of our ambulances at the college, and this ambulance right here can be stocked out fully with all the normal stuff that you would carry in an ambulance. So, again, detail, full immersion, really super important. So you want to demonstrate some skills? Well, we can definitely demonstrate some skills. So, for example, if I were thinking of maybe intubating this gentleman here, maybe that's something that that I can show my students how to do. Now, again, is this going to exactly take the place of me feeling what it's like to intubate a mannequin? Well, no, but this does give that idea and that feel to the student. You can even show the student what it looks like down inside this gentleman's airway, because he has a full airway here. You can tell your students and show your students exactly what it looks like down here in this gentleman's airway. Okay? So, again, if I want to go ahead and intubate this guy, I certainly can do that. Right? Now I have to remove my laryngoscope, of course. Now, one of the things you'll notice is that sometimes gravity doesn't exist. That's a little bit different in the.
Those of you that may be EMS or nursing instructors, you may be thinking right now, is he going to hold that tube? Right? And see, that's the key here. I can say to my student, your tube slipped out. Well, why did his tube slip out? Because you're not holding your tube. You're not keeping a hand on the tube.
In the virtual reality environment, and I know some of you right now are thinking, is he going to ventilate this guy? Is he going to do something? I know some of you were thinking it. I know, I saw it. Well, I didn't really see it out there, but I know some of you were thinking it. Okay? Again, that's that realism feel. I still haven't ventilated him. I'm still talking, aren't I? Right? Well, I still have to inflate the cuff. I have to get rid of the stylet. I have to inflate the cuff. There we go. Get that cuff inflated. I shouldn't let go of my tube, should I? Right? BVM. Get my BVM on him. This guy, I can definitely give him a breath. Now, you can tell me right now, what am I doing wrong? I'm sure some of you can tell me what I'm doing wrong. Way too fast, right? Let's slow it down. One breath every 6 seconds. 1001, 1002, 1003, 1004, 1005, 1006, 1001, 1002, 1003, 1004, 1005, 1006. There we go. Now, what if we don't need the BVM right now? Right? We need to put him on the ventilator. Well, let's put him on the ventilator so we can get him on the ventilator. You know what I didn't do? I didn't check lung sounds, did I? I didn't check to see if the patient had lung sounds when I ventilated. Well, now I can listen to that. And some of these assets, when you put this stethoscope on it, it actually has lung sounds. So I can listen, right? I can check to see whether my tube is placed. I can go through all of those steps. Think of this as sort of your even pre-simulation. You're bringing the students in to show them the simulation, to get them used to the simulation, to get them used to the field. You know, one of the problems that we had in our department was that our students would go into an OR environment like this, and they didn't know anything about the OR. Anything at all. They didn't know where things were. They didn't know what that thing over there was. They didn't know what that thing over there was, and that's what they were calling them, that thing. They didn't understand any of that. So giving that student that feel, that look, what it's like to be inside of this environment, that's what we're looking for. That's the kind of immersion that you're looking for with your students. Well, no tour would be complete without coming to my favorite room. My favorite subject is cardiology, and this is where I started all of my work with a catechist, is cardiology. Now, I didn't start it in this room. This room is sort of something that was developed a little after I had started with cardiology, but I tell you, this has been it's been a lot of fun, especially to get a chance to show you some of the things, the assets in this room, again, being my favorite. So I am going to go ahead and do a 12 lead here on this gentleman. Well, maybe I won't place all of them because of time. You don't want to sit there and watch me place 12 lead EKGs, but this specifically was designed to teach someone how to use correct placement of the EKG, how to do correct placement of the EKG, and how to do correct placement of the EKG leads. Right? So what's nice about this is that your student can get that practice before going out on and working on a real person. Now, we do this sometimes with some of our mannequins. Of course, you can do that with your mannequin. But imagine if your student can come in, practice with this, practice a few times with this, make sure that they've got it right before they then come into simulation, right? You don't want to accidentally place the lead maybe in the wrong place. Those of you that know, that's V2, and that's certainly not the right place for it. so they can get that feel, they can get that that practice that a lot of them really desire before they come in to specifically work with you. So the other thing that we have is, we have hearts, right? And that was, again, one of my favorite things about this is that my students, when I was showing them the plastic hearts, yeah, that was great. Don't get me wrong. It was really great. But to be able to really take this heart, to be able to turn this heart around, to be able to even put my head or my face into the heart itself so that we could look inside of it was really tremendous. And again, look at the realism on the heart. Look at the way that this looks, right? It's really tremendous. Now, one of the things that I always had a little tough time teaching my students, and I don't know, those of you that are EMS instructors or nursing instructors or whatever, AV heart blocks. You ever have your students just, they really have a rough time understanding exactly what's going on with the heart block. So, for example, here's a first degree. You notice we have the EKG on there, and then there's a little animation over there that shows us exactly what's going on as it slows through the AV node, and then it goes down the Purkinje network and out into the to the heart, right? So I can do a second degree type 1, and you can watch that animation changes, and you can see it got slowed a little bit more, and then slowed a little bit more, and then, right? And so that goes right along with the EKG here as well. Second degree type 2, there you go. There's your second degree type 2. And then my absolute favorite is third degree. If you watch third degree, what you'll see is that the signal comes down, it's blocked, but then look, the ventricles create their own signal, and that's shown by sort of that almost like a mist kind of coming up. I thought that was really amazing, right? What a great way to graphically show your students exactly what these heart blocks look like, right? There you go, back to first degree, right? The other thing is, sometimes I like to ask my students a couple of questions in here. And so they can interact with this. They can actually, hit the answers that they think are right. And then once that answer is either correct or wrong, they'll get a little green check mark if it's correct. They'll get a little red X if it's incorrect. So I'm going to go over and take a look at the beating heart over there. And I think you really need to see that. Again, we talk about realism with the virtual reality that we can't necessarily always get in the classroom, right? Now, I've had in my classroom, I've had plastic hearts, I've had pig hearts, I've had all of those things that I could show my students. I have never been able to bring into my classroom a beating heart, okay? Much less be able to split it in half and then show the structures inside the heart. I mean, look at the pulmonic valve. Look at the aortic valve. Isn't that amazing? You can actually see what it looks like to be inside the heart. It's almost like that movie, The Fantastic Voyage, I think is what it was called. Isn't that amazing, right? And I was actually able to show this to my students and explain exactly how the atria and the ventricles are working together. Now, of course, I can stop. And then, of course, when I was teaching my students Einthoven's triangle, that sometimes is a little bit harder to grasp. And so my students sometimes would go, well, okay, wait, I don't understand. You're talking electrodes, you're talking leads. I don't get it. Hey, beating heart, it's my time. Okay? I don't get it. Electrodes, leads, what do you mean, Bill? Okay, well, look at the heart. Here's the heart sitting right in the middle of this triangle, right? And then I can talk about my right arm lead. I can talk about my left arm lead. I can talk about my left leg lead. And I can talk about how the negative and the positive are what the negative electrode here and the positive electrode here are what create lead 1 on my EKG. And then I can explain to them that this electrode this electrode then has a negative polarity, which matches with this positive polarity, and that's what gives me lead 3, right? And so then I can go through lead 2 as well. If I need to, I can pull the heart out, right? If I need that better graphic representation of the heart, if I need my students to see it a little bit more up close, I can pull the heart out, right? So now I just have the drawing in the middle. But I don't know. I like having that heart right there in the middle. And I like to be able to explain exactly why we're seeing what we're seeing, right? And then to be able to come over to my 12 lead EKG and to explain why the right arm lead or the right arm electrode looks where it does, right? And to be able to go right back to Einthoven's triangle if that's what I need to do and explain again, this is why it looks the way it looks. You know, honestly, again, I mentioned that this is my favorite room. I could stand in here all day and I could talk about all the EKG assets that have been built into this room. I really like this room. This is definitely one of my favorites. Well, thanks for visiting. I hope you saw something in your class, or that could help you in your class. You know, I know I showed you mostly medical environments today, and that's because I'm a medical person. But there's a lot more than just medical. You can see right behind me, there's all kinds of scenes. And all you'd have to do is go right up to the scene that you want and hit it. Go right to it. So I hope that this was interesting, and if you have any questions, please feel free to ask. Thanks a lot.
Well, thank you everyone for attending, and I certainly hope that you found something that was of use to you today. And again, if you have any questions, feel free to email me, wballow@madisoncollege.edu, or feel free to find out more about a catechist. You can also go to acatechist.com and you can check out some of the assets there. You can even download the program and you can go into any of those rooms that you saw at the end of that video. You can go into any of those rooms and you can just enter into those. The Catechist Commons is open to everyone, so you can go in, you can take a look. There's even some lectures in there that you might find a familiar voice. So again, any questions, please email me, wballow@madisoncollege.edu. And thank you so much for attending. I really appreciate it. Have a wonderful day.